When a tooth is repeatedly irritated, the pulp can become inflamed and eventually die. When this occurs, root canal therapy is indicated. This involves cleaning and shaping the canals with endodontic files, followed by filling or obturating the root canal system with an inert material like gutta percha. This module, sponsored by COLTENE Whale Dent, will introduce you to GuttaFlow, a new root canal filling system that's convenient, reliable, easy to use, and offers significant clinical advantages over competitive systems. To fill a root canal, dentists traditionally place a master cone of gutta percha coated with sealer into the canal, followed by a series of tightly packed accessory points. This is known as lateral condensation. Although this method of manual obturation has proven to be reliable, it is very difficult to consistently achieve a complete three-dimensional seal within the canal because gutta percha doesn't flow. Additionally, condensing and packing accessory gutta percha points is tedious, time-consuming, and may even increase the risk of a root fracture. As an improvement over lateral condensation, the vertical condensation technique was developed. This technique involves heating gutta percha to make it soft so that it can be condensed into the canal. While this offers some advantages over lateral condensation, it is not problem-free. Because heat is used, the gutta percha shrinks as it cools, causing voids in the canal. This has been an unavoidable risk. Until now. Thanks to the introduction of GuttaFlow from COLTENE Whale Dent, there is now an easier and better way to fill root canals. Clinicians will benefit from the advantages of flowable gutta percha, without the shrinkage. The self-curing material combines two products in one, gutta percha and sealer. The material flows without heating. GuttaFlow provides a reliable, convenient, and time-saving way to effectively obturate the root canal. Achieving a long-lasting, superior three-dimensional seal throughout the canal has never been easier. Here's how it works. The working length is determined. A master gutta percha point is selected, test-fitted, and set aside. To establish the filling depth, a rubber stop is placed on the canal tip and set to the working depth. The canal tip is gently placed into the canal until the tip stops or the working length is reached, whichever comes first. If the canal tip stops before the working length is reached, adjust the rubber stop. Remove the canal tip from the canal. To set the filling depth starting point, move the rubber stop 3 mm down towards the narrow end of the canal tip. This permits the expressed material to flow uniformly up and down the canal. Set the pre-measured canal tip aside and select a capsule to activate. Each capsule consists of gutta percha and sealer, which are activated when the capsule is compressed. The capsule is then mixed for 30 seconds in a triturator. The pre-measured canal tip is placed on the capsule and loaded into the dispenser. Dispense a small amount on a mixing pad, comparing the color to the step-by-step card. The color should be pink. The canal tip is flexible so that GuttaFlow can be applied into curved or straight canals. Insert the canal tip up to the depth of the preset rubber stop. GuttaFlow is gently dispensed from the canal tip into the apical part of the canal until material is seen moving up the canal around the canal tip. Coat the master point with GuttaFlow and slowly and gently place it into each canal. Gently pull and twist the point twice to ensure complete wetting of the canal. Backfill until the canal space is filled, keeping the tip in the material to avoid entrapping air. The excess gutta percha is removed with a heated instrument. The root canal filling procedure is now complete. The goal of obturation is to achieve a bacteria-tight seal. If the canal is not filled properly, bacteria can colonize within the root, causing an infection in the supporting bone and tissue. Because GuttaFlow has excellent flow properties, the gutta percha and sealer fill and infiltrate the entire canal space. Because it's thixotropic, its viscosity diminishes under pressure so that it flows into the smallest lateral canals and completely fills the space between the master cone and the dentin. This confocal laser scan image demonstrates the excellent flow and sealing properties of GuttaFlow. It provides a better seal as it is the first flowable gutta percha filling material that doesn't shrink. In fact, it expands slightly by 0.2%, improving its sealing ability. GuttaFlow is radiopaque with a solubility of virtually 0. There are competitive systems utilizing gutta percha. Most of these products require an external heating source to warm the gutta percha, adding complexity and cost to the procedure. Additionally, heated gutta percha shrinks upon cooling, potentially causing voids and leakage. Thermofill is an example of a heated gutta percha system, using heat to soften the gutta percha and a plastic carrier to transport the gutta percha into the canal. The plastic carrier remains in the tooth, making it difficult to place a post or retreat the root canal. GuttaFlow has no plastic carriers, simplifying post placement and retreatments. There are other obturation systems on the market that do not utilize gutta percha, but rather resin-based filling materials. One example is Resilon. Although Resilon has good flow properties, since it contains resin, it has the potential to absorb water over time, which can affect the dimensional stability of the filling. Resilon also lacks the years of proven clinical success of gutta percha. Another disadvantage of Resilon is that it requires a separate sealing step. GuttaFlow's convenient capsule and dispensing gun system, delivering both gutta percha and sealer in one material, makes it easy and fast to fill the canal, saving time and money. It provides a better seal without heat. There is no shrinkage. Its excellent flow properties allow for optimum infiltration throughout the canal, ensuring a three-dimensional seal against bacteria colonization. The system's individual capsules dramatically reduce the chance of cross-contamination. It's very economical, and there is no heating unit required. And while conventional root canal filling materials demonstrate toxic characteristics ranging from moderate to severe, clinical studies show GuttaFlow to be extremely biocompatible. GuttaFlow is available in a convenient introductory kit. The kit includes 20 GuttaFlow capsules, 20 canal tips, rubber stops, 1 dispenser, 1 box of standard ISO gutta percha points, and 1 box of greater taper points. With GuttaFlow from COLTENE Whale Dent, clinicians now have a convenient, state-of-the-art root canal filling system that makes it easy to achieve an excellent seal for optimal clinical success.